The community of Mphanama outside Jane Furse out in Limpopo is shocked following the deaths of 4 young people. Now, their deaths are linked to the consumption of homemade brew laced with methylated spirits as a substitute for alcohol. In just 2 weeks, 4 lives have been lost, with 2 deaths occurring last week. The substance is popular among young people. For more on this, we do have Dr Kobus Pretorius, who's a clinical pharmacology specialist, to weigh in on the deaths that are linked to the consumption of homemade brew that is laced with methylated spirits as a substitute for alcohol. Doctor, a very good afternoon to you. Welcome to SA Today. So this incident is not a common occurrence, right? But the reality is it does actually happen. Maybe it's just underreported. So how do these merchants actually brew these spirits at home? Is this even legal?
Good afternoon, Alicia, and thanks for welcoming me to your talk. And yes, it's actually not that uncommon, and I think it's because of the fact, like you've said, there's substitution with methanol, which is the toxic alcohol. Ethanol is the one that you can buy commercially, and then the homebrew alcohols, unfortunately, like you referred to, methanol is toxic, and it's just differing by 1 carbon atom. And the problem is identifying actually the fact that it's toxic. So there's symptoms which overlap with ethanol. So the patients or the individuals who consume it actually will feel the same euphoric effects initially, but after a while there could be a delay in presentation, and then because it's toxic, it actually can cause renal failure, it can cause central nervous system defects, can cause seizures, and ultimately death, unfortunately. The treatment is also limited to only giving actual alcohol. Ethanol is the antidote, and in government sector we don't have fomepizole, which is the alternative treatment strategy. But I think the problem is education. We need to tell individuals there's a significant risk with methanol consumption, which if you don't have knowledge about brewing alcohol at home, can be detrimental. And unfortunately, we see it in young individuals in our country.
Absolutely, Doctor. I mean, we last saw the police cracking down on these illegal brews in the country during the COVID pandemic. So are all of them dangerous to consume, though, Doctor? I know as a KwaZulu-Natal girl that we do have cultural brews like your umqombothi, which is largely made of non-lethal components as well as ingredients. But I do know some brewers would then use spirits and battery acid to make their brew even more potent. And it's not like you can actually go and ask for the contraindications label from these largely informal brewers.
Exactly that. And if it were to taste differently, the consumer would have known, because methanol and ethanol taste exactly the same. It's also colorless. So by just brewing the alcohol, you as the individual who's making the concoction would not actually know which one is the toxic one unless it's tested for, which makes it significantly dangerous. And also it can cause blindness as well. So there's significant health risks to home brewing alcohol if you don't have the facilities to test and make sure that it's ethanol and not methanol.
You know, Doctor, we've also seen like a lot of teenagers. I mean, I've seen on social media where they actually mix some of their cool drink, like a normal cool drink, with some other spirits. And we've actually seen the effects that actually happens to those kids. So for those who sometimes do consume these, what are some of the safety precautions, if any, that they can actually undertake? And then what is the best reaction should they suspect to be poisoned?
So the difficulty is exactly in identifying that it is methanol because of the symptom overlapping, but the patients or the individuals will have significant nausea and vomiting, and the best thing would be to go to a hospital and inform the healthcare practitioner that they ingested potentially a toxic alcohol. And it's important, the good part sometimes is there's mixture between ethanol and methanol in the concoctions because of cost. Methanol is cheaper. Like I've mentioned earlier, ethanol is the antidote. So if they consume both simultaneously, in a way they are treating their condition. But as you've mentioned, there is a mixture of the different types of alcohols which then contain the toxic alcohol. And then unfortunately, it's very difficult to tell you exactly which dose would be or how much volume should you ingest which will be safe. There's no safe volume, as just a little methanol can cause blindness, and then sometimes it takes a few days for the patients to present with significant toxicity, where the patients present with renal failure if they don't get dialysis, ultimately resulting in death, unfortunately.
Huge risks there, in fact, Doctor. Now, it's also a bigger concern that the issue of illegal liquor traders who have actually managed to bypass and sneak in either unknown or banned liquor substances in the country. And these actually go unregulated and actually land up in people's stomachs, especially the young who are still experimenting. How do then the relevant authorities as well as communities crack down on this practice, you think?
I think it's extremely difficult, and I think this is why the platform that what you are doing at the moment, Alicia, is educating communities and members of the public to know what to look out for the symptoms, even though it's difficult, but to inform individuals to make sure that whatever they consume, that they are quite aware of what they are taking. As you can see, regulatory practices are still, that needs a bit more attention, at least in our country. And I think a lot of the time it's, like you've said, underage drinking, so individuals get access to alcohol, which is probably not accessed via legal routes because of being underage.
Doctor, thank you so much for that input this afternoon. That is Dr. Kobus Pretorius, the Clinical Pharmacology Specialist, warning us about the dangers of consuming homemade brews.